And here's the risk. There is a new variant. It's called the Delta variant. It's the one that was referred to as the Indian variant that is just, has been killing people like crazy in India. And it is now creeping up to becoming the dominant variant in England, in the United Kingdom, but particularly in England. And there is this concern. It's coming out of number 10 Downing Street. In fact, this Heather Stewart writing for The Guardian, a number 10 source said there are now clearly signs for concern in the data. They were planning on basically opening the country back up in about 2 weeks. And now they're seeing that hospitalization cases are going back up. Children are getting this. This variant has a mutation on the spike protein that apparently shuts down the ability of individual cells to produce interferon, a first line of defense against viral infection. And so, it's much more contagious on for a bunch of reasons. It attaches more efficiently to that ACE2 receptor, and it suppresses the immune system. This is, one of Boris Johnson's people, and Mr. Ferguson said the cases of the Delta variant were now doubling in less than a week, close to what they saw before Christmas when the Alpha version, the original one, or the first variant that was the British variant, took hold and sent infections soaring to a peak of 68,000. Ferguson said there is a substantial risk of a third wave. Evidence is firming up around the Delta variant being 60% more transmissible and more deadly. So what's going to happen when this hits the United States? And people start getting sick and wondering, oh my God, is this COVID? Even people who've been vaccinated, if you've only had one of the 2 shots, for example, and the 2-shot vaccines, this thing will get you. And if you've had COVID before and you think that's giving you immunity, this variant will get you. And what happens when you show up at the hospital, or if you just go to the emergency room to get yourself checked and you discover that United Healthcare has changed their policy now, they're no longer paying for emergency room visits if they decide it's not an emergency. 30 million people with insurance about to get screwed. John in Mexico. Hey, John, what's up?
Hey, Tom, believe it or not, you and I agree on absolutely maybe 10% of this stuff, but I'm a big fan. I still can't help myself but listen to you.
But I have a feeling there's a but coming.
Free speech. Huge big but. You're so wrong on the United Healthcare stuff on about 5 different fronts, but the most important one for your, I guess, audience would be that a prudent person goes to the emergency room, the insurance carrier, whether it's United, Blue Cross Blue Shield, Anthem, any of them, they're going to cover it, right? It's the ones that go to the emergency room for something that is not an emergency that they're trying to clear out, and it's because of exactly what you said. There is no way anybody wants their premiums to be higher because the cost of going to an emergency room has to be factored in.
This company made $5.5 billion in profit in 3 months. They do not have to raise premiums. But this is the story from USA Today. John, I'll just read you one sentence from it. United Healthcare this month told its network hospitals in 34 states, including Florida, that it will assess emergency room claims to determine if visits were indeed medical emergencies. Claims that are determined not to be tied to actual medical emergencies will be subject to no coverage.
And what's your problem with that? You want people going to the emergency room spending thousands of dollars that don't have an actual emergency?
My problem with that is if somebody is having a panic attack,
as an actual...
John, you asked me a question. May I answer it?
I'm sorry.
My problem with that is that if somebody's having a panic attack and they think it's a heart attack, or if somebody's having a heart, half the time it's an actual heart attack, right? Or some percentage of the time it's an actual heart attack. they should go to the emergency room. And if the emergency room determines, hey, that's not an actual heart attack, even though you can't breathe and your heart feels like it's pounding out of your chest, that's a panic attack, here, take a Valium. United Healthcare, this example is not one of the examples used, but based on everything I'm reading, I'm guessing that they would say, no, we're not going to pay for that. What you thought was an emergency isn't an emergency. And what the American Hospital Association, no slouches when it comes to understanding medicine, is saying is that United Healthcare is now telling their customers, you have to be sufficiently competent to diagnose whether a condition that you think is an emergency actually is or isn't. I get it. There are people who use the emergency room as a doctor's office. Those people tend to be the uninsured.
I agree. And, Tom, I'm an insurance agent. I sell this stuff to other companies. And I will tell you, I've helped companies figure out that when their hourly workers don't want to take time off, the only thing that's open when they do get off is the emergency room, and it's costing everybody more money. Let's not use it as a doctor's office. But your point is not correct, and this is what I think I want you to understand. That's what I told your screener. Every single day, you would disagree with an association that is actually in charge of costing everybody else more money, which is the hospital association. I'm not saying they're bad people. I'm just saying their interest is not aligned with yours and mine.
And neither is the insurance industry, John, other than the fact that they pay you commissions for selling their product. But, they are absolutely not aligned with my interests either. These are for-profit companies, and the more they can deny care, the more profit that they make.
How much profit is okay with you for them to make? Because right now it's standing at about 2.5% to 3%. I understand it's billions, but if they took 2.5% to 3% out of the premium, you really think that's going to make a difference in people's lives?
That is not the question. The question is whether they're going to tell people, oh, you thought it was an emergency. Turns out it wasn't after we looked into it, and therefore, screw you, you're not going to get paid. I just find that outrageous. John, we're going to have to agree to disagree. I got to run, too. We're hitting the end of the hour. Andy Levin.